Hello and welcome to Profiles in Risk. This is your host, Tony Cañas, switching to my radio voice. And today I have with me Jane Wang, CEO and co-founder at Optimity. Jane, thank you for joining me today. How's it going?
It's going really well. It's a gorgeous day at the end of July. I have zero to complain about. It's a great day.
Fantastic. July 27, 2023, we're recording on. I am down in my summer home or summer Airbnb down in Buenos Aires, Argentina, where it is winter. Now, winter in Buenos Aires, the last few weeks have been like 55 and sunny. So this is not Canadian winter by any stretch. And I've been watching in the news how the entire northern hemisphere burns to a crisp, basically, with horrible heat waves. Now, Toronto, I'm guessing, while the U.S. is on fire, I'm guessing Toronto is very, very comfortable right now. What, like 65?
Yeah, it's lovely. It's a little warmer today. It's had little sprinkles of showers, so it cooled us down. But right now it's sunny. So, yeah, zero.
Okay, fantastic, awesome. Hopefully, after we're done, you still have time to go and enjoy the afternoon. So Jane, we always give the chance for the guest to give the elevator pitch. What is Optimity?
Well, we exist to help people live healthier and longer. So really holistically approaching physical health, mental health, and financial wellness. We have a technology product that has codified 30 years of behavior science and creating different micro nudges, micro learning, rewards, incentivization ways for people to proactively address their health. So on the continuum of health, we work on prevention, right? Self-care, along physical health, nutrition, mental health, social connectedness, and financial wellness. And then we also work on early detection, early intervention for all the high cost issues. So we talk about, right, cancer, Alzheimer's, heart disease, all the highest costing claims really in the industry. And then lastly, we really help with care. So yesterday we just announced a partnership, and it's one of many in our really caregiver space. So T-Care and I partnered up to really work to support aging in place, not just for the patients or the policyholders, but also for the caregivers that really make it possible to age in place. So yeah, so we have now 2.8 million members on Optimity through either our mobile app, which anyone in North America can just find and download from the App Store and they can use it, or they access it through their employer or their insurance company through sometimes white labeled products. We also sometimes disappear behind health products, so health apps, if they're a prescription, adherence, we help with that. We reward people on their virtual care or any sort of healthy activity that they do for either prevention or early intervention. You may find us behind the scenes rewarding people for those behavior and also collecting the data to really do continuous risk assessment and proactive risk management.
Okay, fantastic. Okay, so holistic physical health, mental health, financial wellness. Number one, I love the combination of those. We so often, in the States especially, maybe Canada's better. So I'm from Costa Rica originally, lived in the States for 21 years, and I'm currently kind of half US, half Argentina, we could say. We'll see. This is a new experiment. We'll see. Digital nomad, hashtag, right? Which basically means homeless with good pay. So okay. In the U.S., we tend to think of health as fixing when something's wrong, usually with a prescription.
Yeah.
And we've historically ignored the mental health part, right? And now we're paying the broken dishes from that. And Gen Z especially is really pushing us. I mean, millennials also, but especially Gen Z is really pushing us to understand that mental health is not optional. That mental health is absolutely a necessity for good living. And then and then the financial wellness piece. Fantastic. One of my biggest complaints about the U.S. and again, I know you're in Canada, but I've barely been in Canada one time thus far.
Most of it is in the U.S. So,
Okay, perfect,
yeah.
perfect. So one of my big worries about the U.S., let's put it that way,
Mhm.
is the financial piece. You can make really good money in the U.S. Gigantic, right? The education is so expensive. Healthcare is ridiculously expensive, uh, and the entire system seems designed to separate me from my money, basically, right? You can go to high school, you can go to college, very expensive. You can go to college and get a business degree and not have taken a single personal finance class, right? Instead, when I started college, I had a great experience in college, but my college ID was sponsored by a bank, and quite literally, like I never activated it as a credit card, but it would have taken a single phone call to activate it as a credit card, right? And the whole system is designed so that you get off on your own and you're already behind financially, right? And so anyway, I'd love to hear more about both the mental health piece and the financial wellness piece, basically.
Yeah, yeah. As you said, I heard three things in what you said. The first thing I heard is, hey, this holistic approach to addressing longevity and health and wealth, isn't this a global problem, right? Isn't this something that's happening maybe in Canada, maybe in the US, maybe globally? And I can say absolutely, it is happening globally, and that's where I spent my first career. I spent a decade in pharma. I did clinical research in phase two, phase three clinical trials. I'm a mortality risk specialist, so I predict adverse events, which are oftentimes death, on these trials. So I got to work on HIV, got to work on ovarian cancer, I got to do MS and also Alzheimer. And what's really fascinating across the different geographies I got to do, which is North America, Japan, and also Europe, so Asia, right? Europe, North America, which is like five of the like biggest cost for everyone, is commonly really talking about, do people adhere to um, drug regimens? Like, do people really take their medication
They don't.
on their own? They don't, right? And when
They
you,
don't.
yeah, when you look deeply into it, why don't they do that? Oh, it's because there's a financial barrier to do so. Maybe the regimen itself is expensive. Oh, maybe there's a actual mental health thing. So, like for example, with HIV, there's patients, they know they have it, they know they don't take it, they're going to develop full blown AIDS, but there's this like whole stigma. They don't want to look a certain way if they take the medication, so they don't do it. So they just marching towards their death within 2 years because of that. So I guess the short answer, is it a global problem? Yes. Is looking at it holistically very important to predicting death and to be able to get ahead of it? Yes, because everything is interconnected and we as human beings are kind of multifaceted, and we're trying to balance, we're trying to optimize, if you will. So, optimity itself is actually a dictionary word. It means a state of being best, to optimize. And we call ourselves optimizers. So internally, we really look at ways to gather data to help people meet them where they are, break down really scary and sometimes really dry topics like financials, scary topics like health, right? Break it into small, bite sized chunks through micro learning, and then attach little bits of joy to it wherever we can, little dopamine hits,
I
boosting
love that.
motivation.
I love that. I attach little bits of happiness, attach little dopamine. I love that. So my second note says tech platform, 30 years of behavioral science. Huge fan already. So how do I put this? On one hand, I'm an MBA. On the other hand, I'm a long-haired hippie Bernie bro. Uh, in the middle, I'm a giant nerd that has read a lot about behavioral psychology and behavioral science. I don't have a PhD in it, but I'm just a nerd about it. And blows my mind how our whole economy is ran from the business perspective of Homo economicus, perfectly rational decision maker, which doesn't exist in real life. And the last 30 years of behavioral science tell me if I'm wrong. Like, you got a degree in this, I don't. Uh, it, the last 30 years of behavioral science tell us that is completely incorrect. People are not rational. People do things like waste their lives on TikTok, or I'm a little old for TikTok, but in my case, it's Facebook, and in my girlfriend's case, it's Instagram. Waste their life on TikTok because it provides them this constant dopamine drip, right?
That's right.
And,
That's right.
and so anything that helps us do the right things and makes those things rewarding, I'm a big fan of already. Anything that's gamified in an intelligent, research-backed way and uses the science, the last 30 years of behavioral science, not to try to sell me another ad, right? Which Facebook is really good in my case, and Instagram is really good with a lot of other people I know. Not to try to sell me something else, but to actually try to help me live a happier, healthier life. I'm a huge fan of, and it sounds like that's what we're talking about.
Yeah. So at Optimity, we have a data for good model. So you're absolutely
Data.
right. Yeah, now we have, oh my gosh, so much data from wearables, from the connected ecosystem of different types of programs, everything from diabetes programs to early cancer detection programs to what the users actually do on our app. We get thousands and thousands of like continuous feed of lifestyle data from them, their hopes and aspirations, their near-term goals, what they're eating, how much steps they're taking today, like all kinds of those stuff, right? And what we use that information for is really to help them live healthier, longer, and better. And I think what's interesting about the 30 years of behavior science is it's from different universities, all types of research, really about human behavior and how we are not really that rational. We kind of chase, we're like little squirrels, like we want to do like three things. We want to chase the next like nugget. We're like, oh yeah, very exciting, let's go for that. And then the second thing is we are actually we like random, right? So that's why there's a funny thing when people go squirrel, like right, you get excited by different things that are
Absolutely.
random. And then the
Mm-hmm.
last thing is that we like to do the thing that's like in front of we like to kind of squirrel away items, we like to accumulate, we like to
Mm-hmm.
collect
Oh yeah.
things.
Oh yeah.
These
Oh yeah.
Yeah, so these are kind of our basic instincts of what to do. So behavior science is let's use that, right, to get the user, to get the member of to do something that is intentional. So we talk about this like what's in it for me, where me spells out meaningful engagement. So how do we get them to do things that are meaningful for their health? Well, it turns out that science has it that more physical activities, such as, doing more steps, is completely predictive in mortality. So we've now done the work with Munich Re and a few of the other reinsurers now to validate that. And now there's white papers out, there's different ways of explaining how that works to an insurance actuary that can quantify that and explain how that works on a block of business. So I think that's kind of the link between the academic science to the practical science to the business case for the work that we're doing.
Okay. I'm surprised that you have a open access side app. So I can totally see this as a benefit provided by my employer or whatever. And the listeners of this podcast are insurance leaders, right? They're decision makers who are close to the decision of what benefits to provide. So we definitely want to talk about why you should provide it to your people. But I am really interested in what is the revenue model like on the individual side, on letting me download the app, when my employer isn't paying for my access.
Right. So the first distinction we have to make is that the public app, the consumer app, is a more basic version of the program. So it only
Okay.
has about 5% of all the features that an enterprise app would have.
Okay.
So for example, on the consumer side, you can connect some of the top 5 popular wearable devices, right? Your Fitbit, your Apple Watch, your Garmin, it does that, right? But on the enterprise one, you can connect over 400 different devices. You can
Okay.
connect your smart scale, you can connect, right, like your continuous glucose monitoring device. You get points for all of those things. So
Okay.
that's, first of all, like a very different connectivity ability between the two. And then also on the consumer side, we use it as a gigantic um, testing pool. So it's a gigantic A/B test pool. So there's over 300,000 users that put their hands up and say, "Hey, you can use my wearable data. Hey, you can use my, quiz answers. You can use my health risk assessment answers to help you with research," right? So we have been using that data set to work with different universities, everything from, Western University to Queen's University to Stanford to University of Michigan, like all types of universities that work with us to publish studies about how can we use micro incentives, these little dopamine hits, to change behavior. And there was a very good one that we did with, I think, 70 something thousand, almost 80,000 users in Ontario, that by creating a step together program, so like you and somebody else, a collaborative program, not competitive, this is different, a collaborative program in a gamified way on Optimity, that together they did more steps than the average person in a very statistically significant way, which is 1,200 more. So over 1,000 steps more per day, right? So that's really amazing. So what does that mean in terms of translating that to mortality? We also have, right, the ability to match it to that through a score. So that's where you can take the research. Is the full ecosystem. The reason we have the consumer app is so we can use it to research. We also work with a number of companies on the consumer app. So we work with like Haven, Ladder, Ethos, PolicyMe, Sonnet, a number of direct to consumer, I would say, insurance companies,
Mm-hmm.
techs, if you will, because they have good flows, and we are able to test out like messaging, sales funnels, and other things like that with them. Um, and we're open to doing more testing. So sometimes now we have carrier clients that are also more experimental, using our consumer pool, because it's just a gigantic tester pool to do different types of experimentation without recruiting, right? Because a lot of these carriers are not used to talking to the consumer customer, the consumer client. So this really changes the practice to be closer to the end client.
Okay.
And of course, the enterprise app has all the bells and whistles. It has, all the different assessments. It has journeys. It has specific things for diabetes management. It has specific things for heart disease. Like it's really focused on outcomes, and it's focused on like rewarding people for, visits, virtual visits or physical, doing the things that will make a big impact on that block of business.
Okay. The enterprise side, how is it distributed? Is it distributed through the traditional broker network, or how is it distributed?
We are testing so many different ways.
Mm-hmm.
So I would say we're in our second inning of distributing it through enterprise. The first inning is really kind of piloting it. We've worked with companies that have their own, agents, completely captive. We've worked with companies that had an independent agent force. So we had, trying to figure out what are the best ways to do that. We've done, 4 or 5 different iterations of that. We've done also work where we work with a group benefits provider, so that we're using like that type of relationship to get in. We've done direct to employer work as well. So we've done like so many different things in that space. Um, a lot of it have, like now we have really kind of industry best adoption numbers. So in the group benefit space, we can get 80, almost 90% of the employees onto the program because our surface area is so big, because we do physical health, mental health, and financial
That's
wellness.
unheard
It's
of. I
not.
mean, I'm not a benefits professional by any stretch. I'm a PNC guy, but 90% adoption on anything is is incredible. And like even 401ks have adoption problems, right? Where I'm giving you free money, and not everybody signs up. So that is fantastic. And what kind of
That's in the
result?
pilot space, right? So yeah, so those are like in the pilot space, and then on the independent side, in a program that's quite similar to Vitality that we did, uh, it's now up to, we won the Ati Navarco Award last year, so it was at 46% adoption for new policies, which is also amazing. Now this year it's at 52%. So I'm like, as we said, we're optimizers. We're always trying to do better. Did we start there? No. Like we started at, 2-3% adoption, and just through iteratively working on it and consistently trying new things, learning from it, optimizing it. Now this is where we're at. And I think that's the first inning, right? So we talked about the first inning being pilots. So some of these groups are, 100,000 policyholders. Like it's not millions and millions of people. It's hundreds of thousands, though. It's a significant block. Now in the second inning, we're starting to do full blocks of business. So that's where I think I'm not expecting 80-90%, but even, as long as you get double digit adoption, you're in the right 10, 20, 30% adoption, you're going to move the needle. So that's where I think as a population health management tool, this is a really great place to do continuous health assessments and to do the continuous risk management. And I do have to argue that it's different than the EHRs and the other types of systems where the hit rates maybe are like you're building from the bottom up to do the hit rates. We are connecting with people through their mobile phones. And guess how many people have their mobile phones? So, right, the
100%.
phone is the biggest wearable.
It's been,
So we're
yeah.
starting from 100% and coming down. So it's like it's a very different model
It's
of
it's been a little
connecting with.
bit since I've been a corporate employee, and the last 4.5 years that I spent as a W-2 employee was at a 100 people company. So it's been a while since I left Liberty Mutual, which was my last big company, a good 6 years ago. But back then, all of the benefits piece was all locked in the intranet, and it was hard to use. It was
Nobody's on that.
unfriendly
Yeah.
UI. I essentially chose my health insurance for the year and set my 401k and basically ignored the rest. Uh,
Yeah.
God knows how much money Liberty spent on me that I truly did not appreciate and did not actually use because it wasn't delivered in a way that was natural for me to access.
Yeah, it's not meeting you where you are, right?
Exactly.
And now you're talking about yourself as a digital nomad. And as people work from home, a more hybrid, they're really, really tapping into not having these desktop programs, not
Hmm.
having these, hard to access programs, but really being on the mobile phone, which is our main modality of accessing the user. And we use a consumer to really inform and to be able to test and learn on a weekly cycle versus the 6 month cycle or year cycle that we have to adhere to when working with a carrier. And then on the carrier side, we had the privilege of working with 16 of them. And I think a lot of them are in the second inning. And I think the third inning is really working with the brokers and the brokerages to use it for a lot of lead generation. We have such a great referral factor. So that's also something that's interesting. So every user on Optimity brings in usually 2.5 or 3 um, like referrals because people tends that people similar to step together, like people don't like to do stuff fully alone. Like if you go play tennis, you have a tennis partner. If you go play soccer, you have a whole team of people you play with. If you right, like if you're on a health journey, like you're usually on the health journey with your partner. Maybe both of you are eating healthy together. Like people tend to do these things similar to our caregiver side, right? Like it's really about the social connectedness. So naturally, people want to do that. So most employer programs in the past, it's a very solo experience. It's a solitary experience on, a website. Who wants to do that? But if I open up a program to you and I say you can download the program and you can invite your friends, your spouse, your partner, your neighbor, whoever your like actual your tennis partner, whoever, then of course you're going to do that and it makes sense, and you've seen that in a lot of consumer apps like Strava that we partner with. So why doesn't it make sense to bring it into this kind of insurance use case as well. So I
Absolutely.
think the third inning is using it to generate more connectivity with would-be customers, prospect, or even current customers to stay up to date with them and to be able to proactively service them in a meaningful way. So I think that's probably what's coming in the next few years.
Okay. So, um, you mentioned, I always like to talk about the origin story. But actually, before we go there, brokerages listening to this that want to have the conversation, distribute this, how do they start the conversation with you guys to get signed up to distribute Optimity?
Yeah, they can just connect with us. It's called engage at optimity.life. So engage at optimity.life. We have people that will be able to onboard you. We really help with that. And we also co-create some programs. So brokerages, as I said, it's going to be in the third inning. So we're very open to different types of ideas. Yeah, so I welcome those conversations.
Fantastic. So I'm always curious about the origin story, and you mentioned a little bit of having worked in pharma, and so you're there in pharma doing drug research or whatever. I'd love to hear what you were doing, and you basically it strikes you one day. I can make a much bigger difference by affecting people's behavior. How did that happen, and what was the path from there to actually starting Optimity?
Yeah. Oh my gosh. It's not the happiest story, but
Okay.
it definitely is how I found my purpose. So as I said, I got to work on ovarian cancer research, which is really around early detection. We were doing self-assessments for patients, and then we were able to triage the top few percent of people that had symptoms, and then have them go through a low-cost intervention such as an ultrasound, and then we found people with stage 1 cancer, and then we were able to operate on them and really, higher cost issues and be able to.
Hold on. Technical difficulty on my side. Okay, so just before my computer decided to die on us, basically, thank you for your patience. I asked you about the origin story, and you said it's not a happy story, and that's when things died. So we can take off from there.
I know. That's okay. It's okay. Uh, yeah, when I did research with the pharma companies, so my whole family is software engineers. I'm actually the weird one. I coded growing up, and they're all electrical engineers. So I just thought people coded all the time, but I was really into sciences, life sciences. So I went and got a degree in biochem at McGill, and then I found out that people weren't really solving their problems using software, but I found, projects that were really about that. So I ended up building a lot of tech platforms for large pharma companies or research companies called contract research organizations, CROs, to really help them collect the information and do patient interaction and all that. In that process, one of the projects that I got to work on was early ovarian cancer detection, where we were screening like thousands of women and being able to predict whether or not they had stage 1 or like cancer, because usually it's like later stage that they find it. And what I found was it was very rewarding work, and we found 11 cases. Sorry, I'm getting phone calls on my
No worries at all.
airplane. Anyways, it's always a hard story to tell anyway, but long story short, here I am making a difference for patients that I'm getting to interact with. And then literally the year that I won an award with my team on this, a day later, the hospital called me, and my mom was sick, and she was 52 at the time, and she had late stage cancer. She had a very different type of cancer. She had leukemia. And then I just spent the next 6 months with her, trying to get her on these great programs that I've been working on, and just like no luck. And I just watched her slip away from me, and she was so young. And and I was devastated. And so I didn't really know what to do for a while. I kind of went, floundering a little bit, didn't really find a lot of meaning in the work that I was doing anymore, naturally, right? So all that has been challenging. And in that search, I did get an MBA during that time. I went into management consulting, so I got to work with more different types of companies, pharma companies as well. And I got recruited into a private equity firm where we were making investments into high growth areas, which tend to be health sector, which is where I was leading a team. And long and short of it, we discovered this need to proactively prevent and address risk. And I'm like, oh my gosh, like I can do something about this. At the same time, the company sent me for executive management training at Stanford. And oh my gosh, what a crazy uh just atmosphere where everyone is starting companies and being part of the solution. And I got inspired. So I caught the startup bug, and I started building my first company. So my first company was called My Health Sphere. It definitely started from an employer solution because I was thinking, my mom was part of uh, like a large company. She had great benefits. Like she could have gotten this. Where could I find people like my mother? So I worked on that company, and it was really interesting. I got to work with 200 plus employers. I really found that yes, we can definitely gather the data, and but nobody spoke mortality risk like I did. So it was really when Munich Re found me. They had me for their innovation day in Toronto, and they're like, hey, this company, they're on the next frontier of using data from Fitbits and Apple to predict mortality. That's where people said, oh, that's interesting. There's another company called Vitality that's doing this. Is this the future? And I think that's where insurance kind of took me by surprise, because they definitely spoke in the same way. They're long-term thinking the same way that I am. They really are financially and ethically aligned. So many companies I work with are like fraternals or mutuals. They really care about the member. And I talk about the consumer clients as members. And then they really are data driven and outcomes driven the same way that we are. But what they don't have is they're not consumer facing. So they don't understand users. They don't necessarily understand behavior science. They don't understand how to make things simple. They live in the world of complexity and data and in the background versus front end. So this is also another reason that we basically created a consumer facing experience and try to optimize for that, because that's our team's superpower. And this is how we can be a very good complement to the insurance carrier and the reinsurance and the brokers, right?
Thank you for sharing the story. I'm very sorry to hear that. It is incredible to see something that can do this much good being born from this, from personal tragedy. Absolutely fantastic. And I love the way. So a few things really caught my eye. Your story of growing up in a family of engineers, and how like everybody codes. That's just the way life works, right?
Yeah.
I grew up in a family of doctors. I'm the only non-doctor in the family, and so it is really interesting. Reminds me a lot of my own childhood. Like, well, everybody's a doctor. I'm the only one that doesn't want to go in that direction. Um, but anyway, the everybody codes part was very interesting, and I love the way that you speak about insurance, because it is exactly the reason that I fell in love with this industry. And like when you I run a website called Insurance Nerds. My license plate is INS Nerd. I am a very visible proponent of the insurance industry, and everybody who's not in the insurance industry looks at me like I have three heads because of that. Because they don't. We have a bad name in the general economy, at least in the U.S. I'm guessing Canada, but holy crap, like nobody likes us basically, and I understand the many psychological reasons why that is, but ultimately the reality is what we do. We help people get back on their feet, and the more technology, the more data that we get. I mean, we have the data. The more ability that we get to proactively use that data, the more that we don't just get people help people get back on their feet. The more that we can help people prevent bad things from happening.
Yeah, we're changing the insurance industry from this like transactional, very like just a piece of paper, completely commoditized product that is cold and gray into this interactive, relationship-based, value-based partner, which is what it's supposed to be. And it started there, right? Like with all the history of insurance, it's the mutuals, the people coming together as a community and to help each other. And I feel like it's really kind of helping it have a circle back, right? Like right? Like we're helping it come back to its origins and do good for the society. And gosh, we need it today. Like the current health systems in the US, it's not just US, Canada too. Like, we have a national paid program. It's going to bankrupt the system if we continue to only address it from the care perspective. If we're only going to, right, give people prescriptions, really only attack it at the end, you end up with more tragedies like my mom and like millions and millions of other people out there where they can like really make small changes, just move a little bit more, right? Like get enough sleep, put enough money in your bank account, be thoughtful about what you do. It's all these little things and they're tiny tweaks and they could be very joyful. That makes a huge difference on a population level. So this is a journey that we're going on, and I'm looking forward to meeting more humans that are interested in this journey. And yeah, that's what we're all about at Optimity.
Fantastic. Jane, thank you so much for your time today. We're kind of out of time, especially with the technology issues I had on my side. This is fantastic.
Okay.
While shortly after we started chatting, I shared uh, uh, the app with my girlfriend's family because they are generally very health aware type people. So basically, I
Mhm.
sent it to our Facebook Messenger group, which is where we keep up with each other, and basically said, "Hey, I'm
Yeah.
interviewing the CEO. Do any of you use this? Are you guys aware of this?" And basically, they're like a couple of them signed up already, and they say that it looks really cool. Uh, and yeah, overall, I can see how this is really important, and I look forward to see you guys continue to grow and partner with our industry. Thank you so much for your time today. When this goes live, I will tag both you and the company on LinkedIn. And in any conferences in the fall that if any of my listeners are looking to meet you guys in person, any conference in the fall
Yeah.
you'll be at.
Yeah, I'm doing many of them. So I'm doing LIMRA actually in Latin America. So I'll be in Panama City
Okay.
in August,
Okay.
where yeah, I'm co-presenting with Samantha Chow from Capgemini about aging in place, which is great research that she's doing, and also we're implementing, like we're actually helping people age in place. So that's great. So LIMRA, I'm going to be doing SOA annual as well because I speak actuary, so this is what we do. And ITC, of course, every year we do ITC. We do the big yoga in like on the beach. We do the morning
Oh,
yoga,
okay,
so the
okay,
mental
okay, great.
health component of it. I don't know if you remember. We do that as well. And then I think I'm adding a new one called Alta World. It's a I'll send the link to you, but it's they did a women in tech, which is also interesting
I
because I feel like
Yeah, I heard decent things about Alta World Women in Tech last year. Uh, I
Yeah.
wasn't there myself, so
It's my first time, so I'll see how that goes. And then in Toronto, there's some like CRC has it, InsurTech North has something in Montreal in September. So we're top 10 InsurTech, of course, in Canada. And then the Reuters event in Toronto is another one that's in the fall. So yeah, lots of stuff going on.
fantastic. Thank you very much for your time today. This was a really wonderful.